Welcome to the deep dive. Today we're tackling a really complex and frankly urgent issue, suicide.
hmm
We've gathered a whole range of sources that, well, they paint a pretty stark picture of this challenge. We're looking particularly at South Korea, but also bringing in some broader global perspectives.
Yeah, there's a lot to cover. We're looking at research on depression assessment, the huge influence of social isolation, different religious
The
viewpoints.
economic side of things too, right? The
Yeah.
costs involved.
Exactly, the economic impact, how media reporting plays a role, and crucially, what experts and the World Health Organization are saying about, actual prevention strategies.
So our mission here is really to pull out the key insights from all this material to give you, the listener, a much clearer understanding of what is just a very multifaceted problem.
It's quite an undertaking, you're right, because the sources really vary, don't they? We have studies zooming right in on specific groups in South Korea, like middle-aged men or people living alone.
And then broadening out again.
Yeah, alongside those wider analyses from the WHO and some really thoughtful discussions on how different belief systems even approach the topic of suicide itself, which is, incredibly sensitive.
Okay, so let's start maybe with the situation in South Korea itself, because those statistics, they really do grab your attention.
They really do. South Korea consistently has the highest suicide rate among OECD countries. That's the Organization for Economic Cooperation and Development, so mostly high-income nations.
And the rate.
It's cited at 27.3 per 100,000 people. And, well, that's not just a number, is it? It signals a very, very serious public health crisis. The government there clearly recognizes how urgent this is.
And they are trying to take action. I saw a mention of things like a unified suicide prevention hotline, 109, I think.
That's right, 109.
Yeah.
And also an online counseling service called Madeline.
So trying to make help more accessible.
Precisely. It seems like they're trying to break down some of those barriers.
Yeah.
And the fact that the government is acknowledging this, upward trend in suicide deaths and is actively trying to collaborate,
Across different sectors.
yeah, with local groups, religious organizations, the media,
Yeah.
it really does suggest a commitment to tackling this, well, on multiple fronts.
Okay, so that gives us a sense of the scale in South Korea. Now, let's maybe dig into that connection between mental health and suicide risk. That seems to be a really consistent thread running through pretty much all our sources.
Absolutely. Depression comes up again and again as a major risk factor for suicidal thoughts. And that's across different age groups in South Korea.
So young adults.
Young adults, yes, and also looking specifically at people, both men and women, who have actually attempted suicide. Depression is a huge factor there.
And it looks like researchers in Korea are actively trying to refine how they understand and measure depression, especially for certain groups. Something about adapting a European scale.
Yeah, that's quite insightful, actually. They've taken the Euro-D scale and developed and tested a Korean version specifically for assessing depression severity in middle-aged men.
Why is that important?
Well, it's crucial because mental health assessments, they really need to be sensitive to cultural context to actually work effectively, right? Adapting a scale like that helps make sure it captures the specific ways depression might show up in that particular group,
Hmm.
which is, vital for catching it early and getting support in place.
Okay. And there's another tool mentioned.
Yes, the Patient Health Questionnaire 9, the PHQ-9. That's mentioned as another widely used and important tool for assessing depressive symptoms generally.
It's also, well, striking how closely tied the economic factors seem to be. We have research looking at economic insecurity and how that impacts mental health, especially in middle-aged and older Koreans. That feels incredibly relevant.
Oh, definitely.
Yeah.
If you connect this to the bigger picture, the research suggests that different kinds of economic insecurity, like maybe your income keeps changing wildly or actual financial hardship, or even just the worry about your financial future.
Just the anxiety itself.
Exactly. That anxiety significantly contributes to both depression and suicidal thoughts in this age group. One study even highlighted that the fear of financial instability was almost as powerful a predictor as actually being in hardship. That suggests a huge psychological burden.
Wow. And this isn't just something happening in Korea, is it? I think I saw a mention of low socioeconomic status and food insecurity being linked to suicidal thoughts in young people globally.
That's a really crucial point to remember, yes. While we're focusing a bit on South Korea because of its high rate, these underlying vulnerabilities tied to socioeconomic factors, they're a global concern. They impact mental well-being and increase suicide risk for young people everywhere, including low and middle-income countries.
Right. Okay, let's shift focus slightly now to social factors, isolation specifically. This feels so relevant today, in our hyper-connected, but sometimes paradoxically quite isolating digital world.
It really does.
Yeah.
And what's concerning is the strong link found between social isolation and depression, particularly in single-person households in Korea.
Mhm.
And this wasn't just one age group. It spanned all of them.
But it was strongest somewhere unexpected.
Yeah, surprisingly, the middle-aged group showed the most pronounced link between isolation and depression.
That is surprising. You might automatically think maybe older individuals would be more affected by living alone.
It just goes to show the need for social connection isn't just an issue for the elderly. For those middle-aged people living alone, the study specifically pointed to economic activity, or rather, the lack of it, as a really significant part of their social isolation that heavily impacts depression.
So, not being engaged through work or other meaningful social activities.
Exactly. When that's missing, it can have a really profound effect on their mental state.
It really highlights that just, being physically alone isn't the same as feeling lonely or disconnected, but that lack of meaningful connection definitely takes a toll.
Hmm. And the WHO backs this up, right? They identify a lack of social support as a key risk factor for suicidal behaviors generally.
Right.
And looking at it from another angle, one study we saw noted how strong family bonds could actually act as a sort of buffer.
How so?
It mediated the relationship between andropause symptoms, male menopause, and overall well-being in middle-aged South Korean men. So again, it just underscores how protective those social connections can be for our mental health.
Let's turn now to a sensitive but really vital area.
Yeah.
Gender differences in suicidal behavior. Are there clear patterns emerging from the research?
Yes, there are quite significant differences reported. While women attempt suicide more often,
Okay.
men tragically tend to use methods that are more lethal. Things like higher doses of medication or more toxic substances like pesticides, which are still accessible in some areas.
And that leads to higher completion rates for men.
Unfortunately, yes, that's the pattern.
Hmm.
It's honestly a gut-wrenching statistic when you think about it. More women attempt, but the lethality of methods chosen more often by men leads to that disparity in completed suicides.
That is just, yeah, a tragic reality. Did the research mention other differences among those who attempt? Like age or employment?
It did. In the study we looked at, male suicide attempters tended to be a bit older and were more likely to be employed compared to the female attempters.
Interesting.
But despite these differences in, methods and maybe the severity of the attempt itself, the research also found something quite striking. Both men and women reported similar levels of ambivalence about actually dying.
Really? So even with the higher completion rate among men, the underlying sort of desire or lack of desire to die isn't necessarily stronger. That's a really important nuance, isn't it?
It is. It highlights that if we only focus on the tragic outcome of completed suicides, we might miss the shared underlying struggles, that wavering intent, that ambivalence experienced by individuals of all genders who reach that point.
Okay, so considering all these factors we've discussed, mental health, economics, isolation, gender, what are the experts saying about how society should actually respond? How do we prevent this? It feels like such a huge challenge.
Well, the overwhelming consensus among experts is that suicide isn't just an individual tragedy, though it absolutely is that too. It's fundamentally a societal issue,
Right.
and it therefore demands a societal response, a comprehensive one. Experts really emphasize that broad public health strategies implemented on a large scale are likely to have the biggest impact on reducing rates across the whole population.
And that means tackling those upstream factors we talked about earlier, like
Yeah.
poverty, isolation, discrimination.
Precisely. Financial hardship, social isolation, discrimination, domestic violence,
Yeah.
these broader social determinants of health, they play such a profound role. Proactively addressing them is seen as absolutely essential if we want to achieve, substantial and lasting reductions in suicide rates.
So it's not just about mental health care access, although that's obviously vital.
No, it's much broader. Experts are increasingly talking about a suicide prevention in all policies approach, which basically means thinking about how actions and policies in housing, education, employment, welfare, not just health, might influence suicide risk and prevention.
And the WHO provides a framework for this kind of action, I imagine, a sort of roadmap.
Yes, the WHO framework is a really vital guide for countries. It stresses the critical need for national strategies that have One, clear political backing. Two, dedicated funding. And three, strong collaboration across all those different sectors we just mentioned.
What are the key elements they highlight?
Key things include working hard to reduce the stigma around suicide and mental health issues, improving how we collect data on attempts and deaths, because good data is crucial,
Right.
investing in proper research and evaluation of prevention programs to see what actually works, and strengthening the responses within both our health systems and our social support systems. And they also talk about responsible media reporting.
Ah, yes, that came up in our sources too. That point about the media's role. Sensationalizing suicide or giving lots of detail about methods can be incredibly harmful, potentially leading to copycat behavior. This idea of contagion.
Yeah, what's quite clear from the research on this is that media reporting can, unfortunately, contribute to an increase in suicide rates. This is especially true when the reporting is very frequent or sensationalized or goes into explicit detail about the methods used.
Is there a direct link shown?
Studies have indicated a kind of dose-response relationship. So the more coverage there is, particularly of a certain type, the higher the subsequent suicide rates can be. And the impact tends to be stronger in areas where media consumption is higher. It really underscores the need for careful, responsible reporting guidelines for journalists.
Okay, shifting gears a bit to a more sort of personal, perhaps philosophical level, our sources also touched on the role of religion and spirituality. This feels like a very nuanced area.
It is indeed. Historically, certainly within Christianity, suicide has often been viewed, well, as a sin. And that perspective stands in contrast often to the modern psychological understanding, which frequently links suicide attempts to underlying mental health conditions, like severe depression.
That it's evolving?
Well, there seems to be an evolving interdisciplinary perspective, yeah. One that acknowledges the deep complexity of suicide, but also recognizes the potential protective effect that spirituality or religious belief can have for some individuals.
So it's not necessarily about condemnation anymore, but perhaps understanding the struggle and seeing faith as a potential source of strength.
Exactly that. For many people, their faith can provide a profound sense of meaning, purpose, resilience, comfort in the face of really difficult times. And that can absolutely act as a buffer against feelings of hopelessness or suicidal thoughts for those individuals.
We also saw some data outlining the pretty significant economic costs associated with suicide. It's quite sobering to think about the financial impact on top of the immense human tragedy.
Absolutely. Suicide and also non-fatal self-harm, they carry substantial economic burdens. You've got medical expenses, lost productivity. Quantifying these costs, while difficult, can really help underscore why investing in effective prevention is so important, purely from an economic standpoint, let alone the human one. It shows the impact goes far beyond the immeasurable loss of a life.
And finally, let's just touch on the issue of elderly suicide. Our sources suggested this is another area of serious concern, maybe linked to a different set of factors than in younger people.
Yes, that's right. Elderly suicide rates, unfortunately, tend to increase with age. They're often associated with things like declining physical health, maybe increased dependency on others, feelings of loneliness or psychological distress.
And socioeconomic factors play a role there too.
Very much so. Factors like poverty or maybe inadequate welfare support are shown to play a significant role in elderly suicide rates across many developed countries, those OECD nations again.
But there are protective factors.
Yes, definitely. On a more positive note, research also shows that things like maintaining social engagement, having strong social networks, feeling connected, these are really crucial protective factors against depression and suicide risk for older adults.
So this deep dive today has, wow, it's really shone a light on the incredibly complex web of factors contributing to suicide. The situation in South Korea offers a particularly stark example, but the themes resonate globally.
Mhm.
We've touched on mental health, economic pressures, the critical role of social connection or isolation, cultural and religious beliefs, even how the media portrays suicide. It all intersects, doesn't it?
It really does. And it's abundantly clear for the sources that what's needed are these comprehensive, multifaceted prevention strategies,
Yeah.
ones that address both individual vulnerabilities and these broader societal issues we've been discussing.
Yeah. Understanding all these nuances, from the deeply personal struggles someone might face right through to the wider societal context, it feels absolutely crucial if we want to foster a safer, more supportive environment for everyone. Hopefully, this exploration today prompts you, our listener, to think about the different levels where suicide can and needs to be addressed. Perhaps it encourages you to find out more about prevention efforts, whether that's locally in your community or on a global scale.
Yeah.
So maybe think about what aspects of this really complex issue resonated most with you today, and what further questions does this raise for you about how we can all collectively work towards preventing suicide?